going back many years ago, it wasn't actually a choice for me at first. It was by chance. So after I finished high school, I always wanted to become a member of the military. So I wanted to become a pilot. I have initially done the application and nothing was coming through. And then my cousin who works in a hospital said that they have opened some slots for scholarship that time. So it was more into the healthcare. So whether psychology, dietitian, physiotherapy, and nursing. So I took the exams and luckily I got the opportunity to get a scholarship to become a nurse. So coming from a poor background, and my mom was a single mom and she raised me by herself, I was lucky enough to get a scholarship. And then it was for four full years of not paying any tuition fee. So it eventually became a choice for me. So my nursing was a chance and then it became a choice. I finished my nursing degree in the Philippines, and I am from Manila, which is the capital of the Philippines. During the bachelor's degree training, it was general trained adult nursing. On the last 2 years, you will be given an opportunity kind of like to choose which way you would want to go after your licensure. But after that, after my graduation from my bachelor's, I was more exposed into adult medical surgical. So I've had a couple of years of hematology and oncology as well, which I greatly love. But right now I am general adult medical surgical. I could always go back to hematology and oncology. So I've been a nurse for 16 years, but 2 years of that was for the licensure, for the paperwork, registration. So it is now 14 years of solid nursing. So I have arrived here in the UK 2018, but I have left the Philippines 2008. So I have been abroad many different countries for quite a few years now. I've worked in different sectors, clinics, occupational health, also private healthcare. So me deciding coming to the UK was more of during my practice, especially with private healthcare, and this is just from my own experience, I saw some discrepancy when it comes to the care being given to people. So it made me think that it doesn't really align with how I see healthcare, which is healthcare is for everybody, no matter what circumstance or place in life you are. So it made me search for countries that provides free healthcare and fair healthcare for everyone. And I think UK being an English-speaking country, I said to myself, like, right, I need to change I need to change now where my practice is coming from. It's not just like giving care, but really, it's more into the fairness and finding about the NHS. It really made me pursue coming to a place wherein healthcare is for everyone. To be fair, I was lucky enough to be assisted by a group of HR professionals, the human resource people from the first trust that I worked in. They have basically assisted us with everything from picking us up from the airport, dropping us off to the accommodation that was initially provided by the hospital. So I was lucky in that sense. When it comes to the social setting, I was intimidated at first just because the setup of the roads are different. People are driving on the other side of the road, in which when you're crossing the road, you don't know, am I looking on the right, on the left? So I think that was initially a bit intimidating to me. But then you get used to it. Opening bank accounts and just trying to settle yourself to live. I was assisted by other Filipino nurses that was working in that hospital as well. So knowing people, speaking to people, and also just speaking up your needs to the people who are assisting you, like the HR, and just telling them that you need to do this, you need to find a bank account that fits to this, etc. And they happily assisted me with that. But I think my most the biggest struggle was the weather. I just did not understand it at first, and I think I gave up on understanding it. You just have to layer up. That's all. It was too cold for me. When I started, I would admit that there were a lot of challenges, especially when it comes to just getting used to the healthcare delivery system. A lot of my background was from private healthcare. The papers were different, assessments were different. Coming into the UK we're in, it's all connected. So social care, clinical care, community care, everything is connected. And this is where I thought that I needed to connect the dots and understanding the actual delivery of care from the moment that the patient comes in through the door until they go home. So it took a while for me to understand and see what is my role as a nurse. The role of a nurse in each of those, from the hospital to the inpatient until they go home, is very vital and important. So that was one of the challenge. But then same thing, don't be afraid to ask questions. Read a lot. Speak to your managers, speak to your colleagues. It really helped me adjust to that. Second would be, I think, the differences of the terms. So I remember when I first came in, they were saying OBS. So OBS were observations. Basically, these are the vital signs, what we used to call back in where I practiced, little things like that. But same thing, go to the educator, go to your mentor, go to your manager, and they would provide you with all the resources. When I started in my first trust and the first hospital that I worked with here, I would really appraise the international nurse recruitment team that assisted us with the logistics of settling in, just the housing, how do you register for your national insurance, how do you get your residence permit, etc. But when it comes to the clinical practice, there is the practice education team. There was an OSCE team that trained us in for us to go through the OSCE exams, and they were very, very helpful. And I think it's more of just being honest to them that I don't understand this, I don't understand how to do that, why do we do that? And they would give you all the answers. And also the NMC website is one of the first few things that they have said that if you're in doubt of anything, especially when it comes to your professional judgment, critical thinking as a nurse, always go to the NMC website. And then through the NMC website, eventually I found the RCN. So the RCN really helped me out a lot when it comes to, especially with the diversity of the practice. It was a bit difficult at that time because I think at that time they were going to go through the change of the OSCE exam. It was initially difficult for me to get the paperwork together, although I have brought them all in with me here in the UK. I think it was more of the communication to the NMC at that time, although it took a couple of months for me to register the paperwork, for me to register the permits, etc. What I did was I kept all the records of all the communication that I have done with the NMC, doing the follow-up, reference numbers, the person that you have spoken to, the title of the email. So I have kept a log of that so that when you contact the NMC again to do a follow-up, it will be easier for them to assist you. So I think that's one tip. With the OSCE, I think what really helped me out a lot is that group studying with other nurses that went through it. And then I borrowed all their notes and I go through it and I compare it with the notes that I have done with every study session that I'm going to do. So that really helped me out a lot in just getting used to the system of the OSCE exam. So I think that's another advice that I can give to nurses that will go through the OSCE. Do not be shy or embarrassed to ask other nurses on what they have done differently or what's their technique. And then eventually you'll be able to put together a technique that's uniquely yours and that's uniquely confident for you so that you can go through the exam just at ease. Although I was still nervous at that time, but I was well supported. Being a member of the RCN, I think it will be around 2 years now. So my first 3 years in the UK, because I've been here 5 years, so the first 3 years, I was just really looking into the website or what are the articles or what's the community that's within the RCN. I have realized that there's more diversity within the RCN. And then apart from that is I had to learn the importance of having an organization that could support you with everything. I also found it really helpful when I was going through my revalidation. Although my hospital at that time was offering courses, was offering other things that you can do so you could get your points, I think I found much more different things that I am interested in doing my revalidation or accumulating the points within the RCN website. So that's one, the variety of resources, especially now that I am doing my master's in clinical education. I have found many different groups within the RCN that you could exchange ideas with, that you could ask questions when you're having difficulty when it comes to my assignments. So I think the diversity really is what really drew me into the RCN. I am currently training to be a learning rep. It was more of really researching and finding out ways on how I can improve myself when it comes to teaching and learning, when it comes to education, because to me, teaching and learning and nursing is what I really wanted to specialize in. There is this calling in me that I am blessed enough to have a very diverse experience when it comes to my nursing, and there's something really calling me in to share it. So I think 2 years ago, or a year ago, I started looking at opportunities or ways to support learners, students, other colleagues as well. It made me look online, and then I found on the RCN website that they're actually training learning reps to support people in the workplace or to support nurses. Also, there is an opportunity, I think, for the RCN for student nurses as well that you can support. So that's how I found the learning rep that the RCN is offering. It's just more of trying to branch out the teaching and learning experience that I wanted to enrich. To be honest, because I think I have done enough research and enough looking around before I arrived in the UK. I have looked into Google Maps on how the place is going to look like, what's the closest grocery shop, etc. to where I'm going to live. So I think I have done the important research prior to arriving here, in which I would also suggest to other international nurses to do that. I think if there's one thing, the tax system. So national insurance, HMRC, etc. These are all very new to me. It took me a while when I arrived here to understand what's the difference of this pension or what's the difference of that contribution. And it's more of just being aware of where does your income go. That's the one and only thing that I would say that I wish I could have done more research. But it's okay. I mean, I've learned it now. I think I'm a little bit more aware now. But I think it's also very broad that you have to understand it. So I think that's one. But other than that, as I said earlier, I was lucky enough to be surrounded by people who are very supportive and who are very helpful. And that's both within the workplace or within the community where I lived, or other communities that I get to know since I moved here in the UK. I really like this question because, I could think of 4 things and I'm going to try and make it as simple as possible. So first is as an internationally educated nurse or an internationally recruited nurse in the UK, embrace the diversity. It's okay to recognize that we are all different. There's no one way of being a human being, because at the end of the day, just embrace the differences and being human. Don't be embarrassed to tell people that oh, I don't know this, it's not being done in my country, can you tell me about this? And you will be surprised how they also embrace your diversity, you being different from them. And this now sparks the curiosity of both parties. Like, you're curious to know more about the culture, they're more curious to know about your culture. And this is now a start of like connecting and communication. So that's one, just embrace the diversity. It's okay, we're all different and there's beauty in it. And also, being a nurse, you encounter people day in and day out. It sparks joy to them, especially when you're curious, which brings me now to the second advice. Nurture your curiosity. If there is something that you don't know, may it be with the nursing practice, may it be with the tax system, may it be with the culture of the family that you're assisting, do not be afraid to ask. There's always a proper way to ask questions. And same thing, you will be surprised on how are they very willing to assist you and help you and to answer your questions. Third is, I'm sure that somehow you will find a little bit of differences in the culture with the sense of humor, which I think really, really helped me out a lot not to be lonely. Watch TV shows, watch comedy shows, because I remember before coming in here, somebody told me to watch a specific comedy show so that I could understand, especially the slang, especially the sense of humor of Scottish people. And it really helped me out a lot. When I came in here and people are saying it this way, oh, that's what they meant. And it's actually very funny. So watch TV shows so that we would get to understand them more. The last one is explore nursing in the UK. I am very appreciative and very proud to say that working for the NHS within the UK as a nurse, it will really offer you a lot of pathways that you can explore so you could further your career. There's so many specialization that you can have a look into, that it can really enrich your love for what specific path of nursing you would want to take. And then from there you would find out that they offering courses like this, they're gonna give you a study day for this, as long as you communicate it to your manager. So just explore that specialty that you wanted to specialize in with your nursing. And there's so many opportunities. Nursing, healthcare in general, is in a bit of a difficult situation right now, especially when it comes to staffing. And this is a mixture of everything. This is after COVID and during COVID, and I think nurses are being challenged in the highest level right now. I know we are exhausted most of the time. I know that we are always complaining about the staffing, etc. But do not be afraid to take a step back and just regroup, especially during the times that it's really busy and you feel helpless. Do not be afraid to step back, recenter yourself, and step up. Because all of us, we are all nurses, we are all practitioners in our own way. And we are here because we are able to care after people. So when you feel like you're helpless and it's too busy and no one's really listening, take a step back. See what your strengths are, and then step up. Tell to your team, oh, I suggest maybe we could do it this way. Let's divide the workload. Because at the end of the day, we all have that power within us as human beings. And we're lucky enough to be nurses, to be delivering care. So it's difficult, but I think we can do it. I know resilience is such an overused word right now, but I think as human beings, we are really resilient. So let's keep going.